So I can't really think of a better time to have this conversation and a more urgent time to have this conversation with you both. I really want to thank you. My name is Gabriela Domenzain. I'm a senior advisor to Brooklyn Defender Services, and I've been an immigration activist for over 20 years. We start with some really bad news, and it's that the first ICE detainee or undocumented immigrant in ICE prison has died from COVID. His name is Carlos Ernesto Escobar Mejia. He arrived in 1980 and was the only one in his family to not be able to have secured a green card or a path to citizenship since being here. And so the conversation that we're going to have today is really, 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 really pressing and urgent. And I kept thinking about this combination of people on this call. So an immigration activist, an epidemiologist, and a whistleblower protector walk into a Zoom meeting, and that's where we are. And we're here because of your report, which was released on April 27th. And it modeled COVID-19 impacts on the U.S. immigration's customs enforcement prison system. Just to give a broad stroke for the folks that are watching, the facts are that the United States runs the largest immigrant detention system in the world. And while a lot of our attention has been drawn to the border because of the atrocities committed there, whether they be family separation, family imprisonment, immigrant prisons and detention systems are everywhere, are all over the country and all over the interior. And this makes it a pressing conversation, not just for those folks that automatically assume, because I live on the border, I live close to a center. This makes it all the more important for all of us to understand. So I want to start with you, Traci. You are an epidemiologist at Brandeis University. If you could tell us a little bit about your work, what is an epidemiologist, and the crux of why you decided to do this report and your main findings.
Sure, thank you, and thank you for the invitation to share with you about our project. It was, it's been a whirlwind, so I'm an epidemiologist. I study primarily, this means that we look at patterns of disease, and we look to study those patterns so that we could understand how to prevent or better control those diseases. And so for most of my life professionally, that's been looking at epidemiology and spread of HIV, overdose, and drug-related harm in the communities. But as we've seen with a lot of these health conditions, they share infectious properties as well as chronic disease properties. They also share some of these same challenges on social determinants and vulnerabilities. Things like for incarceration, for instance, is a huge driver of poor health outcomes and contributes to challenges in the community and connecting people to care. And so I spend a lot of time looking at how we might prevent and help people to survive and return to their communities and their families safely. So for us, this exciting prospect of working on COVID-19 spread in ICE detention facilities brought together some of our really key foci with mathematics and science and understanding a new disease that was coming about and that we had a lot of questions about, but could very quickly see some of those same fundamental properties of infectious diseases and how things spread and how we've understood contagion occurs, for instance, and to think about the people and places we've been really worried about and that we care about. And so for our group of exciting sort of multidisciplinary group worked on this project, included those mathematicians in Canada even, collection of correctional health and whistleblower partners, and epidemiologists like myself, and people who understood the impact of immigration and detention in the community. So
right.
we brought everything together and had the opportunity to then connect with Dana and her group and the huge network of advocates who have been pulling and understanding the data in the community and brought it to a place where we could work with it. And so
let's talk a little bit about the universe here, Traci, right? So what is the universe of detention facilities that you guys looked at? How many people, how many facilities? And let's start with that. I also want to stress what you just said, which is that whether you're in an immigrant prison or in another prison, another kind of prison, your health is already at risk. We know they don't receive proper medical care. We know they, even before COVID, right? Their journeys in many cases, whether you're an asylum seeker, refugee, or an immigrant who's been here forever, have already compromised their immune system and their health. So we were already starting with a population that was vulnerable. Explain to me this population and how you went about finding that, you know, in the least conservative case, if we don't do anything, COVID will impact 72% of immigrants that are in immigrant prisons. And if we don't do anything in the non-conservative estimate, it's 100%. So explain to me the universe and how you get to those numbers and those projections.
Yeah, so there are 111 ICE detention facilities around the country, scattered throughout the many states, and somewhere upwards of 40,000 people contained and alive right now in the facilities. So our real challenge was to understand where in the country they were, who was there, how many people in each facility, men, women, and age distributions, because to do justice to a model, and which is, you know, sort of an approximation of reality to try to help us make decisions and adjust policies. So to model, we have to have the best inputs that we can. So allowing some of the information that's come through Freedom of Information Act requests and long fought in the courts to get to provide inputs into the model. And then we sit with, as a group, and determine what are the factors that are really important to help us see how quickly this COVID-19 might spread in each facility and then for the country as a whole. And so we had to make some important decisions to understand what that larger impact is. So if we're going to say, and you know, as we found, 72% of individuals by day 90, even in the most conservative approach of thinking that this isn't, you know, is it a quick spread, is it a medium spread, or is it a slower spread? Even in that slower spread environment, over 90 days, we're really thinking about 72% of the people in those facilities will be sick with COVID-19. Now, we also wanted to see, what does that mean? So as we've come to know, you can have COVID-19 or coronavirus and not necessarily proceed to have health problems, but the fact remains that many people do. And so we wanted to estimate the hospitalizations that we could anticipate, the ICU admissions that would also occur. So those data we gathered from information from the CDC, and that we're starting to see in other places. And then we had to make estimates about how is spread of coronavirus different in an ICE detention facility versus a nursing home or in the community. And even as we're starting to see, as our group really started to identify that it's very different even in a jail or a prison, because by design, the ICE detention facilities have broader structures, have more crowded environments, have more shared spaces, and move and contact more people. So these all contribute to likely faster spread and potentially more harm. So this was actually one of the motivating factors for why to even do this right now, because the harm potentially is greater and faster. So those are some of the inputs that we brought in to understand and drew from alongside the information, sadly, that we're seeing spread of coronavirus in places like naval ships, to understand contained and controlled spaces with and how does that approximate, and what can we learn from these other places that could help us improve our models and make them more realistic. So it was a real-time science. I mean, we had the base of our model, our math. We understood inputs about the facilities and the how many people were in each space, and generally race, gender, sex, and age demographics. But then we also were learning about how the spread of the virus is so incredibly, it's like wildfire. It just completely takes off. Yeah. So those were ways to help us, and then presenting them in a realistic range, so that people can get the full range of what it means when we say that, more than half of the facilities will see such spread in such a short period of time.
As an epidemiologist and with your colleagues, were you surprised when the data came back being 72% conservative estimate of contagion of ICE detainees with COVID, 100% realistic if nothing is done? Were you surprised by that?
Not entirely, because I think that knowing the constraints, which is sad to say, understanding the constraints of the sites, that we knew it would happen eventually. It's really how quickly it happens, and the urgency of really thinking about. So we need to act soon, very soon, and work to really understand what are the factors that are going to make the biggest difference. Testing a little here and a little there isn't going to make a difference. Yeah. Release is going to make the biggest difference. And so that was what I think, if anything, that really took us to a very clear set of implications of this.
And recommendations, right?
Yeah.
And Dana, I want to bring you in here because this information in this report piggybacks a lot off of whistleblowers, that are experts within detention and DHS, that you all have helped come forward with the urgency of helping immigrants in detention right now. So talk to me a little bit about your organization and how this collaboration came to be, and the importance of this vis-a-vis what you already knew and had already presented to Congress.
Right, exactly. So thanks for bringing us together and for inviting us to talk today. So so I'm an attorney. I'm Senior Counsel with Government Accountability Project, and we are a national nonprofit, and we protect whistleblowers. We promote government and corporate accountability, but we do that by working with whistleblowers, protecting them from reprisal or seeking justice if they experience retaliation, but then working to ensure their disclosures make a difference, because that's really what's motivating employees to blow the whistle. They're seeing serious problems, and they feel compelled to speak. And so we've been actually working in the immigration space since the separation policy was kind of happening in May of 2018. That's actually the origin story of this story, but it's probably maybe good for another podcast. But Dr. Scott Allen he's a medical expert in detention health for the Department of Homeland Security's Office of Civil Rights and Civil Liberties. And we worked together, with him and his colleague, Dr. Pam McPherson, back in 2018, when they came to us because they were deeply concerned that the shift from the separation policy, which of course we know was a quasi shift, but to increase family detention. I think that was going to be the move to solve the separation horrors. They've done inspections of these family residential facilities, had been doing them for 4 years, and saw systemic weaknesses in the ability of those facilities to provide adequate medical care for children. And they were concerned with expanded detention that there would be imminent harm to children. And so that's when we started working with Dr. Allen and Dr. McPherson, helping them raise concerns because they were current contractors, federal contractors for DHS. And so we have been working with them on that campaign, for the past 2 years essentially. And in the course of those relationships and that advocacy effort, where we helped them make disclosures in a way that was consistent with their rights as federal contractors to blow the whistle on substantial and specific harm to public health and safety, we helped them raise concerns to Congress. We did several congressional briefings, and we built our networks with the immigration justice community, who really, are the experts on the ground, who we wanted to make sure, in the goal of making a difference for whistleblowers and making sure that their information is additive, to build those relationships with the folks on the ground, to make sure that we knew what their concerns were and that they could leverage this information from the power of insider information, from medical experts. It's just, it's a game changer, right? You can be, you can file a lawsuit and you can be an expert, but you have someone inside who knows the deal and is saying there's a problem here. It just sparks. It can catalyze tremendous change, and we have seen that repeatedly. These are really embattled times where the power of whistleblowers we've seen very graphically, but also some of those limits, which is again another conversation.
Yeah.
But building those relationships with the immigration justice community was part of an essential piece of doing effective advocacy, as well as working with journalists and the press. We went on 60 Minutes and had tons of press, and it's been really helpful, I think, to the efforts to address harms to children in detention that they were blowing the whistle on way before it became even a concern of folks.
What were they seeing already in 2018 that was so troubling to them that they chose to be whistleblowers?
Yeah, so in 2018, I mean, their concerns were, based on their past investigations, they saw inadequate medical staff within the facilities. So these are often, they're rural facilities that don't have, adequately trained medical staff for pediatricians, for instance, to identify problems. They didn't have adequate translators, which of course is a really big problem if you're trying to do diagnostics around medical issues. They saw the facility structures themselves not being safe for children. They saw non-compliance with detention standards, for instance, some certain examples of using medical facilities punitively, which is like a seriously problematic thing that you never are supposed to do. You can't conflate punishment with medical care. So, some really graphic examples of failure to diagnose malnutrition in a baby that had lost like a third of their body weight, certain basic problems that they knew. Again, these are like examples of systemic challenges. And it wasn't that they thought that, people weren't, there weren't well-intentioned people trying to do the right thing, but they just knew that there were systemic problems, even in terms of how, responsibility was diffuse and confusing in terms of multiple contractors and agencies, and how that can cause inability to respond appropriately to medical issues. Children were given adult rounds of vaccines and that was missed. I mean, so again, they were just like, there's going to be imminent harm with ramped up populations. And of course they saw that. And then when we saw that happening at the border, right, kids starting to die, I mean, even though they weren't just making disclosures about conditions at the border, those conditions at the border were far worse actually than what we were seeing in the detention facilities, right? So it was easy to, it was predictive. And I think they really were helpful in catalyzing outrage and awareness about those problems. But of course, then COVID hit.
Yeah.
And so that changed the world quite a bit. And so Dr. Allen, who again, I've worked with since 2018, he brought on as a new contractor for the Department of Homeland Security's Office of Civil Rights and Civil Liberties, Dr. Josiah Rich, and who's another expert in detention health, also an epidemiologist, and a public health expert, so had a different kind of bank of skill set to add to the investigative teams that CRCL uses to investigate both adult and child facilities. And so, but when they saw COVID spreading, they raise the alarm internally to management about, this is a problem, that this is going to be an issue around how we deal with infectious disease. And those concerns were appreciated, but again, this all happened very quickly. They raised the concerns again in March, but really felt that they had a duty, to raise the alarm more loudly as this was spreading. And so I worked with Dr. Allen and this time Dr. Rich to write a letter to Congress, which again had to be done because again, they're current contractors, right? So speaking out for them is a little more complicated than it is for maybe someone not within the system, right? And so they have rights to do so, but we also know that whistleblowers, sometimes their speech isn't welcome, especially in hostile administrations. And so doing it in a way that is consistent with their protections as federal contractors was really important. And one of those ways is communicating to Congress. And so making sure that we were able to, very clearly document the concerns about the risk, the health risk to immigrants, workers, as well as the public posed by the spread of COVID and immigrant detention, and then their recommendations for release. And to be able to package that for them, again, as DHS's own medical experts, based on what they have, seen in these facilities, what they know just, as medical experts anyway, but with that extra weight, again, of being insiders, essentially, was really mattered. And so then, of course, making sure that their letter to Congress was something that was, from an advocacy, it doesn't end there, right? Then it's like, making sure that press outlets cover that. So CNN quickly covered and published that letter. And then within, it seemed like minutes, but it was all very fast. Litigation teams around the country started contacting me, understandably. And of course, we knew that there were litigation needs happening, right? So, but they were the ones actually executing the recommendations. If the recommendation is release and ICE isn't doing it themselves, we had these teams all over the country filing emergency petitions for release. And they started contacting me because they're all using the letter as an exhibit, so this letter to Congress as an exhibit in their litigation, but also wanting more information, or can they sign declarations or affidavits? And I just started, and they needed more specific information about release plans and to make their case to courts about the real tangible emergency nature of the spread of COVID and what the to validate the recommendation. And I started, literally, I think I had 10 different teams contact me in one day, and they weren't talking to each other. Understandably, they're dealing with this emergency. And so I was like, I'm just going to bring them all together because I can't solve everything. They need to be talking to each other and to figure that out. And so this was the catalyst behind the modeling project, because Dr. Rich is also, actively, he's a professor at Brown, he's an epidemiologist, and he's like, we should do this modeling project. And so, because it would really be helpful, obviously. So that's what kind of was the germ of recognizing this need for more information about the real risk of the spread of harm from these litigation teams that were on the ground, and then being this kind of mediator between the public health community by virtue of my work representing Dr. Rich specifically, who is the epidemiologist. So that's what sparked everything.
Fascinating what you're saying, because I don't think a lot of people understand. We see, and we've gotten all this press. For example, Brooklyn Defender Services has secured the release of over 2/3 of all of our clients in detention. That doesn't happen because ICE was nice and said release, right? That happened because the courts were still open. Even during a pandemic, our lawyers had to go in, risk their safety and their family's safety. And the detained docket, which is the one that we're talking about, is still being crunched through. So every single day, as you said, all over the country, and that's why we're seeing ICE releases, ICE forced release. Lawyers like Brooklyn Defender Services and others have been using this research to prove to the federal government that even your own experts and nationally acclaimed epidemiologists are telling you what is the writing on the wall. These
Right.
folks are going to die.
Right.
And what we receive, I'm on the front lines of this, are the actual conversations with these folks, right? And calls from inside saying they have no information. They, of course, cannot socially distance. They can't be 6 feet away from people. They are now, as you know, hundreds and hundreds are on hunger strike for soap. They need soap and gloves, right? And so having the science and the weight of experts in Congress, experts from the DHS, expert epidemiologists, to say clearly to everybody who's watching, if we don't do anything, anywhere between 72% or 100% of all immigrants in detention are going to get COVID, is something that was critical, not only in us getting the release, but for this call and for this urgency. And one of the things that we all know here, and that you also covered in your modeling, Traci, is that even if you don't care about immigrants in detention, I'm going to assume, because these are the folks that I talk to and because there has never been so much approval for a path to citizenship for immigrants in this country, even amongst Republicans. So even if you don't care about the immigrants in detention, these spots, these jails, prisons, detention centers are spread out everywhere and are next to a town near you, which leads us to the next finding in Traci's report, which is the impact on the local hospitals, and on the local towns that are close, 10 miles to 50 miles from these centers. So Traci, could you tell us a little bit about that?
Sure. So with 111 ICE detention facilities around the country, we looked to see, we took the model another step further. So as we've been reflecting, that 72% of the most conservative model estimates for the country by 90 days, folks would be infected with COVID, but then asking the question of, well, what is the impact on the local community, and specifically on the healthcare system? Because as we know, that's a good bit of why our whole social distancing and many of our efforts that are our best tool to address the flattening of the curve, if you will. So we look to see what would the extra demand for ICU capacity, especially, be in the areas surrounding the facility, 10 miles and then 50 miles. And of those 111, we found that 66 such facilities, so that's 59%, would be overwhelmed with ICU beds needs within a 10-mile radius. And then that changes, of course, if you move to 50, but the idea of in a short period of time, this 90-day period, that we would have pretty excessive demand within the local communities. And I think in looking at the facilities and where they're located, it has even more meaning when you think about the rurality of a lot of the communities. The challenges are great in those communities for spread of COVID-19, and to add on to it the spread within the ICE facilities that would then be drawing upon and needing care in the local health community. It really reflects the importance and the connection and the reality that detention health is public health, and we need to be thinking about the whole community as one that would benefit from an intervention that would slow it down and reduce the demand.
Yeah. So explain to me again the 66% number.
So it's at minimum 66 ICE facilities would have overwhelmed ICU bed within the 10-mile radius. So as a facility has within a local healthcare access, and then we looked at a 50-mile radius as well to see. And the 50 mile is important because it can imagine, like, for a facility that perhaps has a couple hundred individuals who may become infected and have hospitalization needs and have on top of that ICU needs, there may be a medical facility within the center, but it will not have the capacity to care for ventilators and have the ICU special equipment and otherwise that would be available in the larger community environment. So it's not just that sequence to think through, it's also the transports back and forth, having to move people, and then the larger view that this is ultimately avoidable.
Exactly. And there's corrections officers that are going in and out of the facilities and going to their homes and going shopping and doing whatever, right? There's so many, it's permeable. It's a permeable environment that's going in and out. And in that sense, right, I mean, that is the equalizer here, right? So this isn't the walls, whether it's a southern wall or whether it's a wall of a prison, COVID gets through, right? And so it's interesting as we think of, and as folks that are listening to think of, where you live, right? It's very easy to find out if there's an immigrant detention center or an immigrant prison where you live and close by. And it's in your best interest to care that the folks in there are protected, and in this case, released to their families, who the majority of them have, so that they can be safe. Not only because it's human right, not only because it's the right thing to do, but because our hospital systems, it is absolutely no surprise to anyone, are already overwhelmed. And this is this ticking time bomb that we can prevent if we act now. So I want to get to your recommendations and in the report, and also I hope that when folks see these kinds of reports or whistleblowers that are coming out and giving us the information that frankly ICE won't give us and the federal government won't give us, and that it creates change for the good of the country, that this will encourage more people to come forward. We have voices from the inside, and we have folks that are in there that call us, and it's been in the media, etc. But the experts and all of those that also say yes at every single step of this process also have a voice and can do so safely and can express it safely. So let's talk about epidemiologically, what your recommendations were in this report in order to stop the spread of COVID in detention. And then Dana, let's go to you on folks that are listening, and what other people's role could be in helping us get all of these immigrants into safe homes so that all of us are safer.
Yeah, so I think whether you sort of look at it through a mathematical lens, or you think about it epidemiologically, or you think about it through a human rights lens, this is one of the instances where we all kind of come to the same conclusions, where we really need to decrease the number of people who are likely to, in detention, who are likely to get COVID-19. And in other sort of terms, it would be reducing the opportunity for diffusion.
Mm-hmm.
And so, and that density, if you will. So the fastest way to do that, most effective way to do that would be to not to make more cells and more walls and honeycomb everybody around, especially because we don't have time. It's the practical aspects of it, but also the efficacy is not clear because it is so contagious. So the opportunity is to decrease the number of people inside the facilities. And there are alternatives to detention programs that exist. They can work with immigration due process and the full process that has been shown to be effective, and different case management approaches. And I am certainly not an expert on that end, but I think we can take heart in many of the ways that we've seen other states really work towards depopulating or even decarcerating in certain instances, and really thinking about how do you keep people safe. And that really is best done when we can reduce the number of people who are likely to have it spread to.
Exactly. And again, as a reminder, the majority of these folks have homes, families, friends that would take them in gladly. there's absolutely no need for them to be put in this kind of danger. And we know that they are not being taken care of. Dana, let me end with you to talk a little bit about the role of whistleblowers here, and how can people protect themselves if in fact they're seeing things, which I am sure they are, that they want to make public in order to help us all.
Yeah. So, to your point about this being a public health issue, not just an issue that affects immigrants, and you've noted that about the workers who, come in and out of these facilities, they're also at risk, right? So it's immigrants, workers, as well as the public who are at risk of being in these facilities where they're congregate settings. And so it's those workers are the ones who have a lot of power to identify non-compliance with prison detention, the NPDS standards, for instance, or CDC guidelines, and what's actually going on the ground in a way that perhaps immigrant voices are maybe a little bit harder, not necessarily harder to hear, but they have a different legal weight, I guess, to them. And so we are hearing from guards and other folks at facilities who are concerned about what they're seeing inside at the same time. And so that's actually the first recommendation, is that get help before you blow the whistle, ideally. And that's actually been really what's been so helpful in being able to insulate folks who are exercising their rights. That it's a really complicated patchwork of protections that exist for whistleblowers that can depend on what you're blowing the whistle on, what kind of employee you are, if you're a federal contractor or a federal employee, or if you're a state worker or a municipal. I mean, it's and because of the patchwork of the facilities, even it can be complicated to just even assess your legal rights, and your legal rights can at least inform how you make a disclosure in this most safest as well as most effective way possible. So seeking legal advice from experts in whistleblowing is really, really important. So so that's the first thing I would say. And we do have resources that on our website at whistleblower.org/resources. We have a brand new guide that actually we released the week of when most folks started their stay-at-home orders.
Oh, wow.
That week. So on May 20th, we sent the letter to Congress for Dr. Rich and Dr. Allen, but 3 days before, we had released a new guide for federal employees, contractors, and grantees about whistleblowing. So a guide to whistleblowing for those sectors. And so that's free and downloadable. There's also a similar resource for public interest organizations, as well as journalists, who are the ones who often whistleblowers might go to without, sometimes they don't even recognize they're whistleblowers, right? They think of themselves as just, I see a problem and I'm going to go talk to, this trusted group I work with on the ground. So all of the immigration justice folks are lawyers who are representing folk. I mean, those are kind of the outside institutions that employees often have contact with, and they don't necessarily understand their posture, or certainly their rights, risks, and options as whistleblowers. And so those resources are to, help public interest organizations, advocates on the ground be able to make sure that those employees are protected, not inadvertently hurt by making a disclosure, but making sure that that information can get out, and because it makes such a difference. So, so I think that's one thing, is to share those resources and be aware of those resources, and to just, kind of learn the 101 basics about whistleblowing, because it can be complicated. I think the only other thing there are about 20 other things I would recommend, but one big thing I would recommend is that there are opportunities right now to pressure Congress to expand protections for public health and safety whistleblowers in a much broader and more dramatic way that would kind of fix a lot of this patchwork problem that I've been talking about. And that is being discussed, I think, and considered being put in for in the next stimulus package. And on every issue. So when I think about immigrants, like we're seeing this, for instance, we work with folks in the meat industry, which has been a whole other issue that is employing tons of immigrants, that there is an equal degree of risk, right, to a huge immigrant population, working in these meat industry facilities that are obviously at incredible risk, and their needs are not being prioritized. And they are the best protection for all of us. Again, it's both them as well as us. And so protecting workers and their right to speak out about public health and safety threats protects them and us. Like, that's why whistleblowers matter. They stand in our shoes to raise the alarm, but they do so at great risk to themselves. And I think in the COVID realm, we're seeing that risk is just heightened because we're seeing whistleblowers who are also victims, right? They're victims as well as whistleblowers. So there's this edge of urgency of the health and safety threats affecting them as well as the greater public at large. And so expanded strengthened protections for whistleblowers, we just need information to get out there, and we need people to be protected when they speak. And that has been something that's been really problematic. And I think that often what we're seeing with how this administration has responded to COVID has been to avoid accountability, right, and to hide the truth. And we just need that more than ever, because it's like basically the tool that's going to get us through. So whistleblowers on the ground are like one of the most powerful tools we have for accountability and to make sure that fundamental public interests are protected. So that sometimes I think people don't get that, but it's like they are our accountability and oversight mechanism, and that's why we need their support. So
absolutely. No, and it works, right? And the pressure works.
Right.
So I think that there's a lot of websites that we're going to be pointing people to after this. Also the report website, because I really encourage everybody to read it. I mean, it's numbers, it's black and white, and it's preventable. It's preventable. There's one tool that I want to just leave our audience with as well, which was created by Detention Watch Network, which is the Free Them All tool. And basically, if you go on Detention Watch Network's website, you can find your local ICE prison contact. You can find all of the local officials that can pressure ICE to release them. And in some way, I mean, this is what I learned when I was in politics, right? All politics is local. And this is why I think this report is so interesting, because it captivates the interest, the self-interest of a lot of people who might not have thought about immigrants to begin with, right? So I urge you guys to go onto Detention Watch Network and act. And the top line here is that ICE has 100% control to release these people. Our lawyers are fighting tooth and nail everywhere in the country to get people out. Some are succeeding, some are not, but the science is there proving that you need to release them. The experts within the government are there proving that you need to release them. And I hope the conversations like this and the brilliance of women like you will encourage people to act. So with that, I want to thank you so much. If you have anything that you would like to add, I would love to give you a moment, Traci and Dana.
This is great. I just thank you so much for the invitation to talk and share about our project and the paper. And please, take a look at the icecovidmodel.org website for some more deeper dive into facilities that are in the neighborhood. And thank you for doing all that you are doing. And this is amazing.
Thank you, Traci. Thank you so much. Dana?
Yeah, I just, again, thank you. We were commenting before we started this about how valuable it is to twin these, the two pieces together.
Yeah.
And I want to thank Dr. Green. It was a whirlwind trying to, this was an exercise in sausage making of like getting the data and working with, being that go-between between the advocacy community and the public health community was definitely a different challenge that I've kind of I've ever experienced, and that the folks at AILA and NIGC and American Immigration Council and WRC and ACLU and RACIS, like all these teams that are Brooklyn Defender Services, but all the folks who are were really help aggregate data and check and make sure that the model suited the needs, right, of executing release. It was really a profoundly powerful interdisciplinary, intersectional effort, and it was an honor to kind of find myself at the, it was hard, but it was to find myself at the hub of it was really, really exciting. And it's so gratifying to see that the whistleblowers' disclosures are making a difference, and the study, juicing their disclosures is just, it's powerful. It's really powerful. So thank you.
You all are making a difference.
Highlighting this. Yeah.
You all are making a difference, and we're very, very, very thankful. And we have to free them all. I can't say it enough. We will put all of the links into the emails, etc. But thank you so, so, so much for being with us. I know that you all have very busy schedules. And we hope that those that listen, that this really resonates, that we brought it home for them. And mostly that they take action, whether you're a whistleblower, whether you're a private citizen, whether you're an epidemiologist that wants to jump on and keep helping further the science. We really, really appreciate your support. And those inside definitely need us to speak up for them. So thank you so much. I appreciate it. We will be in touch.
Perfect.
Bye-bye.
Thanks so much. Bye.
Bye, y'all.